MDs, DOs, surgeons, attendings, ER physician, physician assistant, physician associate, nurse practitioner. Who's my doctor? Hi, I'm Dr. Nazneen Jamal, and I'm board certified in internal medicine. My goal is to help make traversing the hospital as a patient easier for you and your loved ones. So let's begin. With a number of titles that are now being used in hospital medicine, it's a bit confusing for patients and their family members in figuring out who is who. So we're going to discuss titles that are often encountered in the hospital setting as a patient. Now, this discussion is going to be focused on mainly the United States. Countries have different sort of titles and designations that we will not get into today. The word healthcare provider is what's often used. According to the National Cancer Institute, a healthcare provider is a licensed person or organization that provides healthcare services. Examples include healthcare providers such as doctors, nurses, therapists, pharmacists, laboratories, hospitals, clinics, and other healthcare centers. When you're in the hospital and you're admitted and taken care of there, you will be seeing anywhere from a physician, which is synonymously used with doctor, nurses, nurse practitioners, which have extra training to independently treat in some states or to be proctored and supervised by a physician, physician assistants, which have gone to medical school of their own. They're also known as physician associates, and then other physicians. In addition to that, your healthcare team will include nurses and therapists, which can range from speech therapy, occupational, physical, and even respiratory therapy. And then also you'll have like a social worker and case manager to help you with discharge plans. Some hospital centers will also provide chaplain services. When we use the term doctor, we're referring to a physician who has gone to medical school, completed and obtained a degree. It can be either a medical doctorate or a doctor of osteopathic medicine, also known as a DO. Now, these are all sorts of physicians and all sorts of specialties. They have to have a license to practice in the state that you're being seen. So for example, if you go and you're seeing a doctor, you're under the care of a doctor in a certain state, it is likely that they have a license to practice. We have to fill out a very lengthy application when we're applying for a license. We have to discuss and report our work history, training, hospitals we've credentialed with in the past, and so forth. The state medical board reviews our application for licensure and decides whether or not to grant. For the majority of the cases where physicians request licensure, they are granted. The timing can take anywhere from 1 to 2 months to even more than a year. But most applicants that apply for a license to practice in a state are granted one. Now, if you as a physician are offering services in a telehealth setting, such as over the phone or the internet, you also have to apply for a license in that state, even if you're not residing there. The role of the medical boards of the states is to protect the patients in the states that they're in for receiving standard of care medicine. What's the difference between an attending physician and an admitting physician? An admitting physician is the one who decides that you need to come in and be admitted. When you first come into the ER, the emergency doctor will evaluate you. Their job is to stabilize your acute medical condition and consult with the admitting doctor if they think you need to come in. The admitting doctor will come in, examine you, and be the doctor that puts in the orders to commence your treatment. They'll communicate with nursing staff and document a detailed plan of what they intend to do. Your admitting physician may not be the same doctor that follows you throughout your stay. They may check out your services to another physician if they're going off duty. Your attending physician is the one that manages your overall care. They're the ones that get to decide if you need a consultant to manage a certain aspect of your disease. They're also the ones who coordinate care with your nursing staff, therapists, case managers, and social workers. When the time comes for discharge, your attending physician will be the one to put in the discharge orders and make the arrangements. I hope I've been able to help simplify the numerous terms that are thrown around about hospital staff. Until next time.